knows a lot of textbook information.
Sure.
But then applying it in a practical sense to another human being who's so complex.
Right.
That's such a challenge that people normally don't highlight.
There's a stage of being a doctor in school and outside of the hospital, and then you see doctors inside the hospital and what changes and how they're applying textbook information, academics to practice, and it can be discombobulating, especially for Devin in this first season.
Yeah, big time.
What is the first question you ask in code? Rhythm.
We're on set right now. You have multiple sets here. You have the ER, OR. Do you mind giving us a little tour so we can sort of break down how realistic this is from a medical standpoint?
Absolutely, no problem at all. This right here is the ER.
Okay.
We have 10 trauma bays here. This is the nurse's station.
Yep. Very accurate.
Yeah? Tell me about what this is.
Well, so initially when I walked in here, I was really impressed with the attention to detail. Like, this is really cool to show people at home. The Post-its are legit.
Legit Post-its.
Legit Post-its.
Legit
Our computers are covered in Post-its. These are the phones work. Like,
Oh, no.
Don't look at these.
Yeah.
Patient privacy.
Yeah.
What are you doing?
Don't violate HIPAA, right?
Yeah, HIPAA. See, he knows about HIPAA.
Yeah.
This is very accurate. The beds look like they're functional. The rails go up. So this is this is very
So
realistic.
during a scene, though, dude, so basically we'll be doing
to figuring out how to lower it.
And then it doesn't work?
Yeah. This blood pressure reading is a little crazy, 91 over 132. So this patient
What's wrong with that patient?
This is just not, this is not a live person's blood pressure. The lower number.
Dead.
Yeah,
this person is absolutely dead. So this is the ICU.
Okay. This is very accurate as well.
Is it?
Yeah, the rooms need to be able to be isolation rooms. The way that they're spread apart is very accurate. The nursing station being in the middle to have the view of all the rooms is very important. This chart is actually really realistic also, because when the patient is in the ICU, they can develop something known as delirium, where they don't know where they are, and looking at this can help them a lot. They'll know who their nurse is, who their doctor is. It also is helpful to some of the nurses taking care of the patients to know what they're supposed to be eating. Honestly, if I walked in here and I had no idea where I was prior, I would say I'm definitely in a hospital. Like, there's no way I would say that this is a set.
Now we're gonna move to the OR.
Let's move to the OR.
Which is where all the blood and the guts and the gore and the...
Which was the first scene of the entire show.
Oh, yeah.
Right? That's when
that's when the
mistake
going right
happened.
now.
Yeah.
Mm-hmm.
I got chills during that part.
Really?
Because I've seen medical errors happen in front of me, maybe not to that extent, but I remember it brought up all these feelings of what I felt during those moments.
Right.
And it made you feel as if you were there. So it was,
and especially as a young doctor, when you have, you know, when the responsibility to your job, but also your bosses and the people
a lot
who
of
employ
conflicting
you.
interests.
Wow. This is the ICU room. I mean, there's so much blood on this floor usually, you wouldn't even be able to walk. We have this machine, the blood splatter machine.
Okay.
There's a pump that looks like a helium pump.
Okay.
And attached to it is a clear tube that gets hidden under the clothing or you know, taped behind the arm of the patient. And so when it's time for the blood to squirt, they pump it and the blood just squirts up.
out.
And usually my character is behind that glass just watching.
Yeah, because you're not a surgical
I'm not
resident.
a surgeon. I
But
wish.
You do rotate, right?
We
throughout
do
your
rotate. I think
experience.
right now I'm in the ER, and if I'm lucky, I'll get to move to surgery. But
Okay.
This is another, here, we'll go in here.
Wow.
So in the next episode, which we start shooting on Monday, it's the Halloween episode.
Okay.
And everyone is tasked with a different job. But there's this big Halloween party, so the doctors all go to the Halloween party, and my character is left in the ER to treat this arm that comes in. What up, what up?
These lights are legitimate. You see, like, this little covering on the light is to make sure that even when you touch it, you still maintain your sterility. So Sunshine is the one that generally gives you the guidance on mistakes that you're making.
She's our medical wizard, yeah.
How often is she saying, guys, you have to stop the scene because the technique is wrong here? Does that happen often?
Well, she won't stop it while we're...
Hit that notification bell. Get in trouble? Who's excited for work?
How are you? Good morning.
Are you excited for work, Ginny?
Oh, I'm so excited to see your face.
Isn't it a great day to save lives? I'm gonna sit on this garbage can here.
Don't sit on the garbage can.
No, I'm gonna sit on the garbage can. Don't tell me what
Michael.
to do. You're not my mom. Maybe my work mom. What's the craziest thing you've ever seen?
You're making me think back here.
Yeah.
People that have passed and there's a smile appears on their face within seconds of them totally passing away. That's pretty amazing.
Any good stories, Ginny? Let's cheer people up.
Michael, the good stories is there's lots of men walking around with nice scrubs. That's the best stories.
Ginny's getting feisty today.
Let's talk about INR.
Okay, what about INR? Let's talk about
Not on the vlog.
Why not?
Okay.
INR is when a patient comes in for a test to see if they're taking their Coumadin properly and appropriately. So let's check it out. So when you're looking at an INR, what I'm looking at is to figure out, A, is the patient's dosage correct? B, are they coming in at the right intervals? So if their levels are all over the place and we can't get any stability, we have to figure out why that's happening and we have to check them more often. But if they're consistently having good numbers, we can spread them out. Represent.
Represent, yes.
Jose!
Oh, that's
What's up, baby?
Where you get this from?
Today's a hospital vlog day, baby.
Woo!
You ready for it?
I'm ready.
You
I'm
trying to get
ready.
litty?
I'm ready to get litty.
Yo, you gotta DJ it up. DJ it for our patients.
Which one is?
I want to hear a little reggaeton.
All right, I got you.
Hit me with that little reggaeton.
Them bows and
Come on, it's a party. No. All right, Jose, how many patients are you checking in right now? You don't look like you're working too
I
hard.
just got it.
All right, go do your job, because I need to see my patients. So my typical day goes like this. I come in, I try and catch up on the computer to call patients back, to look at results, to write some notes that I missed the previous day. And then I go in and every 15, 20 minutes, I have a new patient. I'm in and out of the rooms. Like I just came out of a room with a patient who was complaining about really bad allergies. And it's really interesting because typical pollen season is now over. And now we're getting into that wintertime allergy season. And sometimes if you're using the same allergy medication for too long, you can actually build up a tolerance to it. And you need to rotate them. So what we're doing for this patient is we're changing up the allergy medications. We're also giving medications directly for where the symptoms are present. So you think about the nose, the eyes, and we're really trying to get them better by thinking big picture, because it's not enough to just think about prevention. We also need to think about treating the active symptoms. Today's gonna be a busy day, but I'm excited to get started. So I just had to call a patient back for his ultrasound. He came in with gynecomastia, which is he had a breast mass, basically breast tissue developing. And when we do that, we have to check hormonal levels. If those hormonal levels are elevated, then we got to do an ultrasound. If the ultrasound is negative, then we got to do a CAT scan. If that's negative, then we know something. So it's really interesting how we have to follow these sets of guidelines so that we don't do extra testing and we don't do under testing. It's a very fine line that we have to follow here. What's going on?
What's good?
You want to tell the peeps if you get any crazy calls of people asking to come see me?
Yeah. Hi, can I speak to Dr. Mike? No. Can I help you? Yeah, but, can I just talk to him? Can I have his number? No. We don't deal with that here, sorry.
So I'm with Dr. Stuart Green here. Hello. Who is an expert in everything when it comes to mental health. Taught me everything I know. I talk a lot about anxiety and depression on my channel, how rates are going up. Is that something you've noticed?
There is a lot more sort of tension in the large surrounding environment of the country these days. Those things, of course, impact patients' lives, and people who are susceptible to developing significant anxiety disorders, as we say. So yes, there's more of it, and it's affecting youth as well.
All right, because I got a really long day. I only get to eat once before I get home, which is going to be around like 10 p.m. So I picked up some Chipotle. All right, Tia, what are you going to tell me? You're going to tell me about a public patient who is here for an employee physical. We do that here, right?
Yes, we do, actually.
And what do we do generally for those patients?
We just make sure they could breathe and they have a pulse.
What? What does the CMA do? Because no one can answer this question.
Oh, okay. Well, generally, it's a medical assistant. So I'm still able to, like nurses back in the day, bring patients in, do vital signs, draw blood, give injections, and assist with procedures like skin biopsies, toenail removal.
You gave the greatest answer so far.
No problem.
You're a rock star.
Yes.
So I just had a pretty interesting patient encounter. Patient's coming in for an earache. I looked through the patient's notes and she's been here a lot. And I see that she's been diagnosed with cancer. It was familiar to me. So I looked back in my notes and I found that I saw this patient about a year ago. And it was actually me who caught the cancer.
I didn't know this. When I walked into the room, the patient was basically in tears because she was happy to see me because I was the one that initially got the x-ray to find her cancer. Because what happened was she had pneumonia, they did an x-ray, but then when you get a pneumonia, the way it shows up on an x-ray, it can actually cover the cancer, if there is a cancer or anything there. So that's why whenever a person gets better, we ask them to come back in for a follow-up x-ray to make sure that there's nothing behind the pneumonia. And what do you know? She was still a little bit coughing, month went by, I said, let's get another x-ray, boom, there was something else there. Ended up getting a CAT scan a few days later and we found a cancer that was treated, now she's doing great. But now for her to come in for an earache and be doing well after being diagnosed, treated, and her being really happy, she told me something really cute. She says, my kids, especially the little one, are such big fans of yours. And I said, because of YouTube? They're like, no, because you saved my life. And I said, oh, how old is your little one? She's like 39. We have one of our staff members that's been here for almost a decade and a half.